Okay, so we're back, right? And you know that while we were away, because this is the third video, the first video was how do you organize your handouts to prepare for your mastery session, study session, if you will. The second part of this video series is the videos themselves and how to take notes on the videos, right? You saw that. Now we were supposed to do our UWorld questions, and I'm going to show you 6 questions, and it took me about 40 minutes, 30 to 40 minutes. I would say 45. That's why I tell you don't do any more than 5 to 25 questions at a time, because just doing 5 questions, I did 6, will show you that it takes time to take notes on the rationales from the UWorld questions. So I want to say, just to start out with, remember what we've accomplished so far. We talked about the first step in preparing for a study session using the HETV videos, and my plan with the UWorld was just to look at the handout that you have. Some of you don't have handouts. This step doesn't necessarily apply to you. If you don't have the 200, which is half off for a week, because as of Black Friday, the sale is off, and you just want to use notebook paper, that's fine. Again, that's fine. Some people do maximize their money a little bit, and they'll go and get the pink packet bundle, because a lot of what I have in my hand and what I've used even just today is pink. And so that's like on sale for $50 until Black Friday, and then it goes up, right? So that's called the Oh My God packet, as well as procedures, pharmacology, psych meds. There's other packets in there like management of care, all kinds of things, infectious diseases. There's a lot in that pink packet bundle, okay? But for today, we said, when you're preparing to take your notes and do a study session, always have your Oh My God packet out and your procedures reduction of risk. So let's just remind you what that looks like. That's your procedures reduction of risk. And then, of course, the famous Oh My God packet is out every time you begin a study session. Remember that the reduction of risk is the #1 area of failure with basic care and comfort. So that's why you have that out as well, just in case there's any procedures. Now, during today's study session example, I did not use anything in the reduction of risk. I did not, surprisingly, really have to use anything in the medication categories, because there wasn't any specifics about medications in the 6 questions I did. Pharmacology, didn't have to use that. What I used today in my entire exercise of this example of a study session was I used the packet that I'm in, which is the handout for psych. I used the other packet that I use for psych, which is psych meds, right? And then I used, of course, the Oh My God packet. You typically will see that. You'll always use the subject packets, and you'll probably always use the Oh My God packet at some point during your study session when you sit here to do this, okay? Now, so when you look at the board here, we've already went through the handout process, going through each handout to match it up with the video titles, so that you put a V on the handouts that you know you're going to end up using, and then all the other handouts are just extra handouts you can use for extra notes that might come along as you're looking at the video. Step 2 was the video itself, how to find it, where it's at, what to do with the YouTube, the fact that you can play it on your television at home or your cell phone, and that it should always be with you, the fact that you always start with the playlist. This third step was the UWorld, and I want you to remember that when it comes to doing UWorld, I don't care if you're an LPN. I don't care if you're in LPN school. I don't care if you're trying to pass an LPN test. You must still buy UWorld RN 90 days. You'll thank me later. Trust me, okay? Because the UWorld LPN is not good enough, okay? Speaking about software, Archer is no good. Yes, some people will pass with Archer. Some people will pass not doing anything. Think that through. But if you're trying to pass, you're deliberately trying to do everything you can so you never take this test again, ever. Or if you're lucky, only one time ever anyway. But you know, if you're trying to pass this test, let me help you. I've got the PhD. I've done the work. I've looked at everything. And Archer is nothing. I'll give you an example why Archer is not good enough. Many students, if not 90% of everyone I talk to, and I talk to millions of students, they say they did Archer and they were getting 70s, and they were doing UWorld, same student, and getting 50s. So they didn't like the UWorld because it wasn't showing them a better score. Well, duh, then you failed the test. Guess which one of these softwares was more accurate? Yeah, UWorld. So many people say, I didn't like it because it was too hard. Think it through. Saving lives is pretty fucking hard. You need a hard software to help you learn how to do it. Oh, it's my pet peeve. Okay, so anyway, Archer's not in, UWorld is in. I don't get kickbacks from UWorld, so fuck you if you think I do, because I know some of you do. I don't get anything from UWorld, and guess what? I don't want anything from UWorld. That's called power. I don't need money. I don't need you to buy me and tell me to sell your product. I hate when I get on YouTube and they're selling all these products. That ain't me. I'm never gonna sell somebody else's shit, okay? What I'm telling you is I've done the work, and UWorld is the best. Now, you do have to know how to navigate UWorld. So stay with your girl. I want you to stay with your girl and see what we're doing here, okay? So here we go. Let's pretend you and I are doing our psych mastery for the first time ever. So I'm gonna come up close, and I want you to see my phone, and I want you to create the test. Now, this is where things get really crappy if you're not careful. If you're at home, always use tutor mode so you can see the answer as soon as you do it. When you're in my class, you don't do that, but you use it in tutor mode at your house. When you're in the classroom, I want you to get done, so I switch the mode. This mode will have it where you don't get the answers. You get them at the end, but you don't get them right away. No, you want tutor mode. Then I want you to look at the next section, which is called question type. When you're trying to do something for the very first time, you hit all of these. If you have never used your UWorld yet, then the only thing that you'll make sure that you hit is the unused, because you've never used it before. So all your questions will be new. But make sure that you at home use traditional and next generation test questions at your house, okay? Now, let's go to next, because we're not done setting up the actual, test. So here we go. When you go to this one, you're gonna see it says select subjects. It's crazy, but just roll with your girl. You're gonna hit all. Then I said we were doing mastery in psych and psych meds. So you hit next, like I just did, and you'll get your select systems. Now, of course, I have to pull the phone away so that you can scroll with me. And one of the things I teach you if you're using my Oh My God packet study guide is page 4 has all the subjects, right? So if on page 4 it has 2 subjects on one line, you've got to select 2 subjects on one line. So watch this. I have the subject of psych and psych meds. This is alphabetical. Many of you want to text me and call me and bug me and make me want to kill you when you text me and say stupid stuff like, I can't find psych. What? Here's why I want to choke you. Because you're not being a critical thinker. If you were a critical thinker, you'd know that mental health concepts was the same thing as psych. So quit acting brand new. Then you're not done, because on page 4 it says psych and psych meds. So you have to scroll down and you have to click on, and it's in alphabetical order, psych meds. So the young lady I was talking to earlier today was shocked that I knew there was 34 questions in psych meds. It's like, this is not my first rodeo. I eat, sleep, and drink this. Okay, then you hit next. And if you're smart, because, you know, I was sitting here doing this today, you will only do 5 to 25 questions. 5 is really the best number. I did 6 so that I could see if I could get an anorexia nervosa question, and I mean, an eating disorder question. I actually did get one. So you set it by scrolling till you get to the 5, and then you'll see, tap this, I think. Oh, wait, duh. Hit that, and then it'll go right in there, 5 questions. And then you're ready to go. Now, if I go to next and show you this screen, I'm going to be arrested by the UWorld police, so I'm not doing that. But let me tell you about the questions I had. And I'm just going to tell you the subject based on the first sentence and what I did right then. So when I went to UWorld and I pulled up my questions, oh, by the way, oh my God, I can't believe I almost forgot to tell you this. Okay, so don't ignore these 3 lines right here. The 3 lines have a way for you to go to your previous test, pull up all your tests, and I want to show you what to do. Let's go to this one. 25 questions. Let's tap it. I did this on purpose so I could show you how to label it. Edit test name. And then I'm going to put M and then psych. That's what I labeled it. Okay. So there you go. That's how you label all your tests. When you come to my class, those tests better be labeled. And so you label that. And then when I did my test, and I want to just review it for shits, kicks, and giggles, I'll go back and look at it. And for example, the first question talked about, let me see. Hold on, guys, because I don't even remember half the time. Hold on, baby. I'm not going to read the question, and I'm not trying to go to UWorld police. I mean, I'm not trying to go to UWorld jail, so don't even try it. You know how that is. But I'm going to go back to my previous test and just pull up the questions that I did have without reading them or doing anything stupid. But my very first question talked about a patient being brought to the hospital with fear, intense fear. What you've got to remember in psych is when you start talking about intense fear, that's like a panicky type of thing. That's anxiety. Fear and anxiety go together. So then you look in your handout, which is what I had to do. I had to look in my handout for something that I could write on that meant fear or panic or something, right? And so what I do tell you, and sometimes I tell you this in class, but I was really glad to get that question, because what I do is I tell you to make this page that talks about obsessive compulsive disorder also include PTSD and anxiety on it, because these 3 go together. They're all types of anxiety. Then I was looking at this page. This is not a page I know I have to write on. We talked about that earlier, which pages you know that you have to write on based on the titles of the videos. It says imminent deadline distress disorder. Look at the people. They look pretty freaked out. I don't know what the hell imminent deadline distress disorder is. I don't know that I give a shit what that is, but I do know I need a handout to take good notes. So I use this as my panic attack handout. That was smart, because I think I got like 2 questions on panic attack when I was doing this, okay? There's this one question that I want to point out to you, and it was on bipolar. So let's go to bipolar. So once the question, I didn't even answer the question yet. Once I see it's on bipolar, I go to the bipolar handout. I didn't even finish reading it. I just want to be on the handout so I'm not wasting time. So I go to the bipolar handout, and I keep in mind that this is also part of bipolar. So what they talked about in this case was that the patient came in acute manic episode. Well, that was perfect, because I took notes both on this, and you can see the notes I took, and then I took notes on this, and you can see like a select all type of list or format that I used. You can see I highlighted actual words used on the test, the actual testing question. Okay, so I had 2 handouts that I got a lot of information on just on that one question. And by the way, if you're doing UWorld and they give you like this chart, oh honey, take real good notes, because that's what they did when I actually finally got an anorexia nervosa question. And I'm going to go to that now just so I can't show you, obviously. Again, I don't want to be in UWorld police, but I am going to go to the question itself and point out that, you know, this thing was like a wonderful little chart. And so you already know when you go to these questions that you're going to get basically a chart on some of them. This one was a select all that apply, and it had 6 options. Then I scrolled down. It was a question on anorexia nervosa, and it had a big ass chart. Oh, honey, let me tell you something. Take them damn charts real serious. Those charts are select alls or case studies. So I'm going to show you how many notes, and I don't know if you remember what it looked like before I did the rationales, before I took notes on the rationales, but I'm going to show you how many notes I got. Look at that page. It's completely full of information, completely, all the way down to the very tippy top bottom and then the tippy top, okay? Now, here's the thing. I want you to pay attention to this. When I was taking notes from my videos, if you'll remember on the other video, I used orange highlighter, blue colored pen. Let's review. So there's some blue, there's some orange. Let's go all the way down. There's some more blue, there's some orange. When I took notes, and you should do this, when I took notes on the rationales, I wanted to use a different color to point out this is how many notes I got. I used pink and I used green, and I really want you to see this. Look how crazy this is. Oh, and I used blue highlighter, pink, green pen. There's a little bit of green, not much. There's a little bit of green, but let's look at the pink. Pink, 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 like a whole lot of pink, right? And then we put the blue because this was on the software, and we used asterisks in green when something I said on the video was repeated on the software. This is how you accentuate your notes so that you know what's on the test. This is how we do it. It's how I learned to teach you this stuff. You have to remember, I delivered babies for 20 some odd years as a nurse midwife. I did not do well, sometimes I did do anorexia nervosa, but I sure as hell didn't do a whole lot with schizophrenia. I didn't do a whole lot with the gallbladder surgery. I didn't do a whole lot with cirrhosis of the liver. I didn't do a whole lot with brain injury. Are you serious? Come on. What did I have to do? I had to study it. I had to learn it. I had to teach myself. I had to look at videos. I had to look at questions. I had to read books, Iggy to be exact. Yeah, this big old fat book here, just let me point that out in case you ignoring yours and trying to get rid of it and sell it and all the rest of the stuff that y'all be doing. This big ass fat book is how I prepare for you so that when I need to learn something and teach you, I don't come across looking like an idiot. The other thing you got to remember is when I first started teaching NCLEX, we didn't have EKGs on NCLEX. I didn't learn EKGs at Ursuline College. I didn't learn EKGs in my graduate school at Case Western Reserve either. I didn't learn EKGs in my midwifery program. So I had to self-teach myself EKGs. How do you think I did it? Videos, textbooks, reading. I did what you did and what you're doing. That's why I can be so passionate about the fact that you're going to pass. Because if I can teach my dumb ass, old ass EKGs, come on now, you can do this. So I really, really, really hope this helped. This was video number 3 of 3 videos. And it was just showing you how to take good notes and maximize this whole entire, basically nursing school on HETV. If you want the handouts, they are available. If you don't buy the handouts, you can't afford the handouts, you ain't got no damn money, Shelly played too much, you can use notebook paper. Stop acting crazy. I didn't have no damn handouts. I had to make these for y'all. So when I first started, I just was doing notebook paper, and it is horribly boring, and it doesn't really, it's not as effective, but it's what you have. So work it. Last thing. Do not make me come and choke you out, shank you in your kidney, and pull your eyelashes out one by one. What am I talking about? I'm talking about those of you who failed the test and then schedule that bad boy 45 days later. That's some bullshit right there. Yeah, I need you to take more time. If you failed this test, take more time to really learn it by looking at the videos. My videos, I mean, they're great and all, but I'm honest and have integrity enough to tell you there are beautiful videos out there. I may not do the best job at that particular video. Maybe someone else does a better job. You've got REMAR, you've got Simple Nursing, you've got RN, Registered Nurse RN, you've got Climac, you've got Simple Nursing, I think it's called. You've got Mike Lanier or somebody. I mean, you've got a million options for learning the content before you go repeat, take this test and fail again. Pump your brakes. I love you too much not to, let you know that that's one of the stupidest things I've ever seen. 45 days later is planning for another 45. I mean, really, don't just reapply for your test. Take time. In Florida, if you went to school in Florida, prayers are going out. Your whole existence where school is concerned is bullshit, right? You know it and I know it. It's like a scam. So what I want you to do is make sure you know how to apply to take your test in another state, because there's a scam going on in Florida. They have the shittiest nursing schools. So you, of course, fail your NCLEX repeatedly. And by the time you fail 3 times, they make you go to another shitty program called remediation and pay $2,000 for that. Stop it. Don't even take the first test in Florida. As a matter of fact, as soon as you can, get the fuck out of Florida. After all, you and I both know they're racist. They said that slavery was good for us, and they're taking Black history out of the history books. So, yeah, don't want to be there. Okay? Just saying. Personal opinion. Deuces.